Nurses. Nurses are defined as someone to go above and beyond the call of duty, the first to work and the last to leave. A unique soul who will pass through your life for a minute and impact it for an eternity. During this pandemic, nurses have been working 24/7 in saving other people's lives while putting theirs at risk. As we all have seen in tons of news or articles, nurses have been working very hard to the point of exhaustion. Long hours caring for patients, fears about contracting the virus, separation from loved ones, and redeployment. The pressure on nurses has been unrelenting since March last year.
Good day to our beloved panel, CIs, classmates, and viewers. We are the Group 3A from BSN 3D. We are proudly to present to you our research study entitled Factors Affecting the Level of Job Satisfaction of Nurses During the COVID-19 Pandemic. The presenters will be myself, Jilan Lea Malvas, Lance Xavier Manigos, Christian John Maravilla, Christine Joyner Kia, Jertimir Vance Oxenia, and Mitzi Lorraine Pescuela. As COVID-19 pandemic hit the country, a lot of medical workers, especially nurses, have resigned from their jobs due to various problems. Nurses play a pivotal part in the sustainability of healthcare systems, thus organization needs to keep nurses motivated and satisfied about their job. Job satisfaction is the degree to which the employee believes he or she is having job stability, career growth, and a comfortable work-life balance. And there are various factors internally and externally affect the employee's inclination to work, willingness to go extra mile, compliance with rules and procedures, and their alignment with organizational objectives.
For the objective, this study aimed to determine the factors affecting the level of job satisfaction of the staff nurses in the hospital. Specifically, this study aimed to answer the following questions. First, what is the profile of the staff nurses according to age, sex, marital status, and area or department? Second, what are the factors that affect the level of job satisfaction according to level of pay and management, leadership and social relationship, and quality of working conditions? Lastly, what is the level of job satisfaction of the nurses during the COVID-19 pandemic? For our methodology, we have research design. We use quantitative descriptive design. For the participants, we have 30 staff nurses. For instrument, we used a researcher-made questionnaire checklist was used to collect necessary data for the analysis. For validity, we use Good and Skates. And for the reliability, we use Cronbach's. For the statistical treatment, survey data was processed using an Excel spreadsheet, analyzed and interpreted using the Statistical Package for Social Sciences or SPSS. The first, second, and third objective use a frequency count, percentage, and mean.
For the demographic profile of the participants of this study were classified as to their age, sex, marital status, and department or area of exposure. The result in Table 1 establishes the fact that the majority of the participants are staff nurses who are working during the COVID-19 pandemic belonging to the age bracket of 31 to 40 years old and 41 to 50 years old, which is 30%, followed by 23 to 30 years old, 23%, and 17% for 51 and above years. In terms of sex, most of the participants were female, having 18 participants, compromises 60%, while male, having 12 participants, compromises 40% of the total participants surveyed by the study. The table for marital status indicates the majority of the staff nurses in the hospital that are married. As reflected in the table, most of the staff nurses are married, with 19 participants, 63%, followed by single staff nurses with 8 participants, 27%, and with the least number of participants are widowed, that having 3 participants, 10%. And as observed in the table in terms of areas of exposure, the emergency rooms have the highest number of participants, which are 8, having 27%, the main nurse station, 7, 23%, and the OPD having 5, 17%, and the female ward with 4 participants, 13%, pedio ward, 4 participants, 13%, and lastly, with the least number of participants, which are male ward having 2 participants, having 7%.
Table 2. Factors affecting the level of job satisfaction of nurses. The table presents the factors affecting the level of job satisfaction of the 30 staff nurses. The table shows that the factors that mostly affect the level of job satisfaction are the level of pain management, leadership and social relationship, and quality of working conditions. For the level of pain management, as reflected in the table, Staff nurses are satisfied with the level of pain management with an average mean of 3.8. Question number 1, the mean is 3, with 60% answered satisfied and 25% answered very satisfied. Question number 2, 53% answered satisfied and 43% were dissatisfied with a mean of 2.6. Leadership and social relationship. The table shows that the nurses are very satisfied with an average mean of 3.7. Both teamwork during pandemic and relationship with co-workers showed very satisfying rate with 3.7 means each. Quality of working conditions. The table shows that nurses are satisfied with working conditions in the hospital with an average mean of 3.4. Question number 1 with a mean of 3.6, 57% answered very satisfied and 43% were satisfied. Question number 2, 60% answered satisfied and 23% were very satisfied with a mean of 3.4.
So for the table 3, level of job satisfaction of nurses during COVID-19 pandemic. The result establishes that the nurses are satisfied with their level of job satisfaction with an average mean of 3.5. As reflected in the table, staff nurses are very satisfied with the nurse-patient ratio to patients or COVID-19 positive, the resources available, the transparency of the management, and if the work is evenly distributed, especially in this time of pandemic. For question number 1, 43.3% answered very satisfied. Also, 43.3% answered satisfied, and 13.3% answered dissatisfied, which means that a number of staff nurses are contented with the nurse-patient ratio with a mean of 3.3. For question number 2, 56.7% answered very satisfied, and 43.3% answered satisfied, which means that a large number of staff nurses are contented with the resources for work available during this pandemic. For question number 3, 50% answered very satisfied, and 50% also answered satisfied, meaning staff nurses are contented with the transparency with the management. For question number 4, 46.7% answered very satisfied and 53.3% answered satisfied, which means that most of the staff nurses are satisfied with the even distribution of work across the team.
For the conclusion, first, the demographic profile of the participants shows that the majority of the participants belong to the age bracket of 31 to 40 years old, which is 30%, and 41 to 50 years old, which is another 30%. Most of them are females, married, and assigned to the emergency room. For the level of pain management, the participants are satisfied with their salary and overtime pay. In the leadership and social relationship, the participants are very much interconnected with each other. For the quality of working conditions, the participants are very much at ease with the precautionary measure and the amount of workload provided by the hospital. For the level of job satisfaction of the nurses during the COVID-19 pandemic, they are satisfied with the nurse-patient ratio, the availability of the resources, transparency of the management, and the distribution of work across the team.
Creating a work environment where the staff nurses can provide good quality services and have a maximum level of job satisfaction will be beneficial for both patients and the hospital, especially during this crucial time. Compensation and benefits are certainly important to nurses' job satisfaction. Given the demanding and stressful nature of their work and the educational requirements, nurses may be inclined to seek other types of employment if they are not compensated adequately. We recommend an improvement with overtime pay of staff nurses during this pandemic. The staff nurses need to be rewarded with the overtime work for them to be further motivated in rendering their service.
This is the end of our presentation. Thank you for your time and thank you for listening.